Welcome to our deep dive today, all about Clonazepam. You might know it better as Clonopin. We're looking at it from a nursing perspective. You've given us some really great sources about this medication. It seems to be prescribed pretty often, so we're going to try to help you figure out the most important stuff about using it and how it's given to patients.
Yeah, it really is.
Yeah.
It's a fascinating medication. It can be used for a lot of different conditions, but just like any really powerful tool, you have to understand how it works. That's the key to giving the best care to patients.
Okay, so let's get started. For those of you listening who might need a little refresher, could you explain exactly what clonazepam is and maybe how it works, like on a chemical level?
Sure. So clonazepam is part of a group of drugs we call benzodiazepines. They're well known for having calming effects on the central nervous system.
Okay.
And clonazepam does this by making a neurotransmitter called GABA work even better in the brain. You can think of GABA as a kind of brake pedal for how active our neurons are. In clonazepam, by boosting how GABA works, it basically reduces how much those neurons fire. So that leads to a sense of calm
Yeah.
and, less anxiety.
Okay, so it's not like a general sedative or something. It actually has a specific target, that GABA pathway.
Right.
Now, thinking about it from a nursing perspective, what are some of the things a nurse has to do right away when dealing with clonazepam?
Well, one of the very first things is to make sure you give the right dosage. You have to really stick to the doctor's orders.
Yeah.
That means knowing about the different forms of clonazepam, like
Yeah.
it comes in tablets, oral solutions.
Yeah.
And you got to make sure the patient gets the correct amount at the right times.
And I'm seeing in these sources that there's a lot of emphasis on giving the medication correctly. Why is that so important for this particular medication?
Yeah, you're right. It's super important that clonazepam tablets are swallowed whole.
Okay.
You can't crush them, can't chew them. Doing that changes how fast the drug is absorbed. See, the tablets are designed to release the medication slowly, in a controlled way. If you mess with that, you could get these unpredictable spikes in the drug's concentration in the blood. And that's a problem. It can make the medication less effective. And it might even increase the risk of side effects.
Oh, so it's all about keeping that steady level of the drug in the bloodstream.
Exactly.
So, okay, you've given the medication. What's the next thing on the nurse's list?
Monitoring. Monitoring is key. It's something we do constantly. We're looking for two main things. Is the medication working, and are there any side effects?
Okay.
So on the effectiveness side, we want to see if the patient's condition is improving. Are they less anxious? Are they having fewer panic attacks? If they were having seizures, are those happening less often? Those are all signs that the clonazepam is doing its job.
That makes sense. What about the other side of it, though? The side effects. What are some of the usual things to keep an eye out for?
Well, the ones we see most often with clonazepam are drowsiness, dizziness. Sometimes people have problems with coordination. In my experience, I've noticed those side effects are stronger in older adults and also in people who are just starting on the medication. Nurses really need to be careful about these, especially in places where safety is really important, like a hospital ward.
Yeah, that makes me think of that warning you always hear about not driving or using heavy machinery after you've taken this medication.
Exactly.
It sounds like those side effects could have some pretty serious consequences in the real world.
Oh, absolutely. And that's why educating patients is so important.
Yeah.
But we can talk more about that a bit later.
Okay.
For now, let's maybe focus on the side effects that are less common, but potentially more serious.
Yeah, the sources mention some things that sound kind of concerning.
Right. So although it's rare, clonazepam can sometimes cause something called respiratory depression,
Okay.
especially if someone's taking other medications that also depress the central nervous system,
Mm.
like opioids or alcohol. That means the breathing rate slows down. And in really severe cases, it can even cause the oxygen level in the blood to drop dangerously low. It's super important to know what other medications a patient is taking and if they're using alcohol.
Wow, that sounds like a situation where you'd need to step in right away.
Absolutely. And then there's another side effect that's less common, but important to be aware of. It's called a paradoxical reaction.
Okay.
In this case, a patient might actually get more anxious or agitated, maybe even aggressive, instead of calming down like you'd expect.
That seems kind of backwards. Why does that happen?
Well, we don't completely understand why some people react that way, but it does show how important it is to keep a close eye on patients. If a nurse sees those symptoms, they have to tell the doctor immediately.
Okay.
That way the doctor can reconsider the treatment plan. Sometimes a simple change in the dosage or switching to a different medication is all it takes.
So basically, close observation and talking clearly with the whole healthcare team are really key when you're managing clonazepam. So we're back talking about clonazepam and looking at it from a nursing perspective. Before we took a break, we were discussing some of those side effects that don't happen as often but can be more serious, things like respiratory depression and those paradoxical reactions.
Yeah, and those just really highlight how important it is to be careful when you're giving this medication and then keeping an eye on how the patient is doing.
Absolutely. But it's not just about what's happening inside the hospital or a clinic, right? There's also that really important part of preparing patients so they can take clonazepam safely when they're at home.
Right. Patient education is really fundamental if you want to make sure things go well. It's all about giving people the tools to be a part of their own care.
So where do we even begin? What are some of the basic things a nurse should talk about when they're teaching a patient how to manage clonazepam?
Well, one of the first things I always stress is that it can make you drowsy and dizzy, especially when you're first starting to take it. I remember this one patient, I warned him about this, but he decided to drive home after his first dose anyway. He ended up rear-ending someone at a stoplight.
Oh, no.
Thankfully, no one was seriously hurt, but it was a real wake-up call. It just goes to show why we put so much emphasis on this.
Yeah, that's a pretty powerful example of how these side effects can have real consequences.
Right.
So, what other advice do you find yourself giving to patients?
I always make sure to tell them about alcohol. It's really important they know not to drink while they're taking clonazepam.
Okay.
Because when you combine the two, it's like they amplify each other. It makes the sedative effects way stronger.
I see.
And, that can lead to a lot of drowsiness, trouble with coordination, and in some cases, even problems breathing.
So it's not just about feeling really sleepy. It can actually affect you physically in a serious way.
Exactly. Yeah. And another thing, it's so important that patients understand they can't just suddenly stop taking clonazepam without talking to their doctor.
Right.
Stopping abruptly can trigger withdrawal symptoms. Those can be anything from anxiety and not being able to sleep to much more serious stuff like seizures, especially for people who've been on the medication for a long time.
That makes sense. So it sounds like you have to taper off gradually with the doctor's guidance.
Right. And while we're talking about other medications, it's really important that patients give us a complete list of everything they're taking.
Okay.
That includes over-the-counter drugs and even herbal supplements, because some of those can interact badly with clonazepam.
So it's like that saying everything in moderation, but maybe in this case it's more like everything with awareness.
That's a good way to put it. And that awareness should include the possibility of long-term effects from using clonazepam. I mean, it works really well for a lot of people, but it's not usually meant to be taken for long periods because there's a risk of developing tolerance and dependence.
Could you explain what those terms mean in this context?
Sure. Tolerance happens when your body kind of gets used to the medication over time. You end up needing higher doses to get the same effect you used to get.
Okay.
And dependence is when your body becomes physically reliant on the drug. If you stop taking it all of a sudden, you'll have withdrawal symptoms.
So it's a bit of a balancing act, isn't it? You want to manage the condition effectively, but you also have to minimize the risk of these long-term problems.
Absolutely. And that's why it's so important to stay in touch with your healthcare provider. Regular checkups mean the doctor can adjust the treatment plan, maybe explore other options, and, the patient can bring up any concerns they have.
It goes back to that collaborative approach we were talking about, building that partnership between the patient, the nurse, and the doctor.
Exactly. And that goes beyond just going to appointments. It can be helpful for patients to keep a journal, write down their symptoms. That way they can track any changes or anything unusual that happens. It can really help the healthcare team make decisions about their treatment and make sure they're doing okay.
So empowering them to be a part of their own healthcare journey.
Exactly. Now, we've talked a lot about being careful and aware, but I think it's important to remember that for many people, clonazepam can be a really good thing.
Uh-huh.
I mean, it can give significant relief to people who have really tough conditions, like anxiety disorders, panic attacks, and certain types of seizures.
Right. So it's about understanding both the benefits and the risks, and then using it carefully and with all the facts.
And we're back for the last part of our deep dive into clonazepam. We've covered a lot of ground, right from how it works chemically to the actual care that nurses provide and how to educate patients.
It's been a really interesting conversation.
It has. And now that we're wrapping things up, I'm curious, what are your thoughts on everything we've talked about so far? What really stands out to you?
I think for me, the biggest takeaway is that you have to be really careful when you're managing clonazepam. It's a strong medication.
Yeah.
It can really help people, but there's also a potential for harm. And you have to think carefully about every step, like from that very first assessment to figuring out the right dose, and then, of course, monitoring how well it's working and watching for any side effects.
You're absolutely right. It really shows that nursing is so much more than just following a set of instructions.
Yeah.
You have to think critically, advocate for your patients, and always be ready to adjust your approach depending on the person you're caring for.
And it really underscores how important it is for everyone in healthcare to work together.
Yeah,
Nurses aren't working on their own.
right.
They're constantly collaborating with doctors, pharmacists, the whole healthcare team. That's how you get the best results for patients.
Definitely. And that teamwork is especially crucial when you're dealing with long-term use of clonazepam.
Uh-huh.
There's the risk of tolerance and dependence. You have to keep a close eye on things, and there's always the possibility of interactions with other medications. All those things require a team effort.
It all comes back to making sure patients are empowered. They need to have the information and the support to make good decisions about their health.
Exactly. And, this brings up a bigger point that I think is really important. And everything we've talked about today, the focus on individual care, being proactive about communication, educating patients, all of that represents a patient-centered approach to healthcare. And that's something we should aim for in every part of medicine, not just when we're managing clonazepam.
That's a really powerful message for our listeners. It reminds us that healthcare isn't just about treating diseases.
Yeah.
It's about taking care of people, respecting their choices, and giving them the tools to live healthier, happier lives.
He said it perfectly. And as we finish up our deep dive here, I'd like to leave our listeners with a question to think about. How can we take the lessons we've learned from managing clonazepam and apply them to other parts of our lives? How can we become better informed about our healthcare, more involved in taking care of our own well-being? How can we be better advocates for ourselves and the people we care about?
That's a great question to consider. It reminds us that learning never really stops. Every new bit of information we get, every insightful conversation we have, every step we take towards becoming more empowered individuals, it all adds up. Thanks for joining us today as we took a deep dive into the world of clonazepam and what nurses need to know. We hope you found this discussion helpful, interesting, and maybe even inspiring as you continue to learn about healthcare. It's an amazing field where science and compassion come